Okay, I want to thank everybody who has gathered here today. We're going to be talking about thyroid and your health. And I am pleased to have joining us today Chris May, who is the owner, proprietor, and our most favorite pharmacist over at Seaside Pharmacy. Thyroid and your health. Thyroid issues are a thing that many Americans deal with, and it plays a role in some of the things that I deal with as a plastic surgeon, such as skin issues, hair loss, hair issues, and pretty much thyroid deals with every aspect of your physiology. So these are just some questions we're going to answer today. What is a hormone? Which ones especially affect women? And what can go wrong? And that is a lot. Okay, so basically hormones are chemicals that are released into the bloodstream, and they are regulators of specific body functions. But we know that our body is designed amazingly, and so there's lots of interaction. So although a hormone may have a primary organ, it will have effects on pretty much the entire organ system. For females, the ones that come to mind are going to be thyroid. Now, of course, men have thyroids too. So this is not to say that men don't have thyroid issues. I know plenty of men that do. But autoimmune disease of the thyroid is more common in women than in men. And men sort of have an expectation that their hair is going to get thinner as they get older. But as women, we don't like that. And so we, if it's a thyroid issue, we want to deal with that. Your thyroid is a little butterfly-shaped organ that's located sort of across the base of your throat. There are some pictures. Everybody here, and I recognize some of them, sort of, this is the Bushes, that's Rod Stewart. I can't tell you who these people are, and that looks like somebody's baby. But the whole point is that people of all ages and genders can have thyroid issues. It can be something that happens suddenly. Okay, it can be something that gradually occurs. Your thyroid just sort of peters out type of a thing. So it just depends on, how about this? Thyroid has nothing to do with particular genders or particular ages. So I think this is a concept that's sometimes a little bit challenging for folks to understand, is that when we look at thyroid function, a primary test that looks at thyroid function is something called TSH. Okay, and so what is confusing, and I'm going to give you a way to remember to make it not confusing, is that people say, well, my TSH was high, but my thyroid isn't working properly. That's crazy. Why would, if it's high, it should be like overworking. But the point is to remember TSH is something that's coming out of your brain. So I just remember that this is sort of a horse and buggy system. So the driver is your pituitary gland, that's up at the base of your brain. The horse is the thyroid, and the buggy driver is sort of you, okay? And so what happens is that when your brain is communicating appropriately to your thyroid, and your thyroid is doing its job, the horse and buggy are just going nice and smoothly along. The brain doesn't have to get very excited. The horse is happy, and everybody in general is happy. Okay, if your thyroid, the horse, gets slow, then your brain, which is the pituitary, has to get excited to get that horse into gear, has to slap those reins. And when the pituitary gets excited, that is when TSH goes up. So that's why TSH going up means that your horse, your thyroid, is slow. Now, the other way can happen is you can have a runaway horse. You can have a thyroid that is totally out of control. And you've seen people that have goiters. They have what's called hyperthyroidism. Hyper is just what it means. It's hyper. And so those people are like slender, and they have shakes and tremors, and their heart races fast. And darn them, they get really skinny. It's really obnoxious. But hyperthyroidism usually is something that people don't, I'm going to use the word live with. They don't tolerate that very much or very long. that usually pops up as, you know, this is not right. I didn't feel like this several months ago, and I'm feeling really wired and tired and weird. Okay, and they'll get that addressed. Whereas I think on the other end of the boat, when you're hypothyroidism and your horse is a little bit slow, unless this is something that happens when you're really young, this is usually something, and I'm a female, so I'm gonna address it from a female perspective. We'll let Kristen talk to us about guys that have treated. But I think a lot of times hypothyroidism is something that gradually happens, and it's associated with some other changes in your life. So sometimes a lady will go through a pregnancy, it's stressful, her thyroid goes out of whack, and it's basically, oh, well, it's just postpartum depression, you know, you're trying to recover from having a baby, and so that's really, the thyroid is not necessarily the very first thing it's looked at. Or it can happen around menopause, and the lady just has the expectation, well, I guess I'm going through a change in life and I have all these other things going on. I just feel sluggish and bloated. I can't lose weight. You know, my hair's getting thin, but I guess that's just the way it is. Unfortunately, there are physicians, we live in this very busy medical world, who it's very easy for them to say, well, yeah, you know, you're a little bit fluffy, but you know, you just need to eat better and exercise a little bit more and, you know, shoo, going out the road. Okay, and so that is, Chris and I have both seen folks who their thyroid is being treated, so they're being treated for low thyroid, but they still sort of feel, you know, a little bit slow, a little bit sluggish. I still can't quite lose the weight that I want to lose, even though I'm putting forth effort. But they told me my numbers were all normal. Okay, so we'll talk about how that happens. So I'm going to go a little bit into this. This is the reason why I came up with a horse and buggy picture, because if I start looking at this, that sort of makes my brain start quivering. I don't like that. But it is the physiology, and you basically just see this is one part of the brain talking to another part of the brain that then sends a message to the thyroid gland. So it's like a whole messenger system. The thyroid gland then releases its two products, which is T3, T4, and then they go to the rest of your body. What happens is that if your thyroid makes, when it makes just a little bit over what it needs to, then it gives what's called a feedback. It basically tells the brain, okay, you don't need to push me anymore. So, you know, sort of like the horse is going a good clip. And so then he gives feedback to the brain, to the buggy driver, okay, you don't need to whip me, you don't need to giddy up me because I'm going at a good pace, okay? Any questions or thoughts so far? Okay, so what does the thyroid actually do for you? Well, it releases, we talked about, these are all sort of initials, T3 and T4. And the 3, it says here we see tri. Okay, so 3 and 4. Now 4 is the one that it's sort of like, I'll say, a not as active portion. Your body makes more of this, but then it converts it into T3. So what happens is T3 is, I'm going to say, the more active thyroid hormone. When Chris does compounding, he compounds a ratio of both because it's normal to have a ratio of both. But understanding that we are depending on your body to take some of that T4, which is, I'm going to say, is more of like a slow release version, okay? So if you were just to give someone pure T3, they would burn through it, and then they would crash and burn. So if T4 that's a good thing, is sort of a slow release version. Your body converts it to D3 as it needs it to get you through your day, okay? What happens with some folks is that and we'll get to that, they are not as good at getting the T4 into T3. So remember, T3 is the more active portion, and you can be given a T4 only product. So a lot of people are familiar with Synthroid, which is a T4 only product. And it works pretty good for them, but for whatever reason, we'll get into that, they are not that great at converting it into the more active version, which is T3. And so even though their numbers look normal, they just don't quite feel normal, okay? So again, a little bit sluggish, a little constipated, a little muscle cramps, a little hair loss, a little fluffy, those types of things. I mean, and I think it certainly is frustrating as a patient to know that you're not quite right and go to your doctor and then they go, well, your labs are okay. And I think that's something that both Chris and I were taught, is that we're supposed to treat the patient, not just a bunch of lab numbers. So the lab numbers are a guide, but it's our responsibility to also listen. Now, it's a two-way street, and sometimes folks, and I understand it's intimidating, it's like, okay, well, maybe it is just sort of all in my head. Okay, well, maybe it's not that big of a deal. Well, it is sort of all in your head because that's where we have this whole pituitary thing going on. But it isn't in your head in that you're making it up. You know, thyroid, it just says it all here. I mean, you know, it does a bucket load of things. It is essential to your well-being. If your thyroid is kaput, you'll be dead pretty quickly, okay? Some of the, I'll say somewhat early symptoms of low thyroid function are cold and sensitivity, where everybody else is somewhat normal. If you go outside, your fingers are like super freezing. You're sort of cold when everybody else is warm. So if you think about that, makes sense. So it's sort of like when your thyroid function is low, your body sort of goes into hibernation state to sort of conserve energy because you just don't have a lot of mojo going on. You need to conserve energy. Versus if your thyroid is like hyper, of course you're zzz, and you're like hot and you know all those things that go with being hyper. This just kind of gives you what we've talked about, which is a majority of the thyroid hormone that's secreted by the gland is going to be T4. So you look at this 80-20 ratio. So this is sort of like your slow release, your instant release, but then as it gets to the target tissues, it's converted. Okay, and so then we're going to talk about some of this. That's a perfect segue. And so you have a version of this slide, okay? And so this basically talks about things that keep you from making the proper amount, things that then slow down your ability to convert, okay? So, and things that increase your ability to convert, okay? And so I think that that's where, again, you go to a doctor, you know, I can't tell how many women will tell me this. I just always have felt like my thyroid's not quite right, okay? And so I'll get a health history, and sure enough, like every female in their families had some sort of thyroid issues. I keep going to the doctor and they keep telling me thyroid is okay. So I think that's where you're looking again at just the main marker, which is what your brain makes, which is the TSH, which is that thing that sort of tells your thyroid, gives the thyroid direction. So that's the buggy driver in the whip. They look at that and they say, well, you know, he's not having to whip really hard, so everything must be okay. But the problem is if you don't have enough of these key cofactors, then you are not going to be doing a good job of converting your T4, which is your slow release, into what is your active form, which is T3. And so there's some times where, quote unquote, your thyroid is okay. So I wouldn't say that, you know, that a person needs to be on a thyroid medicine, a replacement. But certainly we all know stress messes with everything. Inflammation messes with everything. So that's where sort of an attention to lifestyle and nutrition are going to be important. And that's where a lot of times we will do what we'll call nutritional assessment. We'll look at someone's zinc levels, their magnesium levels, their vitamin D levels, the B12. Look at all of those factors, understanding that all of these things play a role in thyroid. And understanding that the thyroid plays a role in basically your entire physiology. Okay, very good. So we see all these things. And so it's you know, we do have men have issues. But, you know, impaired memory, tenderness, weakness, children have it, hoarseness, muscle pain, constipation, a lot of stuff. Look at here, high cholesterol. So, I mean, there are things that we deal with as health issues that I think it's important to say, okay, well, you have high cholesterol. Could it be that my thyroid isn't working quite right? Or I'm anemic. One of the signs of thyroid issues is a low-grade anemia. Do I have a reason for being anemic? And the point is with iron, if it's a vicious cycle. If you're low on iron, you're not doing a good job of converting your T4 to T3, and then that makes you more anemic. So it does become a vicious cycle. Again, this is just a visual to say that your thyroid affects the rest of your body. And I think this helps me make a point, is that unfortunately in 21st century Western medicine, we have this very organ-focused, system-focused way of dealing with people. And so you go to a heart doctor, you go to a lung doctor, you go to a GI doctor, you go to a brain doctor. But the problem is that we're not walking hearts, lungs, kidneys, brains, and GI tracts. We are this thing called a human being, and we're all integrated. And so, your gut affects how your brain thinks. So if your gut's not working properly, then you may be showing signs of your brain not working properly. And then that's the same thing, is if you're anemic, maybe it's not because you've had blood loss, but because your thyroid is out of whack. So I think it's incumbent, and I'm blessed to work with Dr. Green too, and I think in family practice and internal medicine to a certain extent, there's more of this view of sort of a whole person approach, okay? Not just zeroing in on, well, that's not my organ system, so let me send you off to this other organ system doctor. And then this just is an illustration of all the different things of those body systems. And, it's a lot of stuff. You're like, ooh, I hope I don't ever get thyroid issues. But the chances are, if you're a female, are relatively high that can happen. This just talks about the concept of, we talk about the horse and buggy, hyper and hypo. And then this just gives you, these are some visuals about, it just illustrates. This is a lady whose thyroid is overactive. So she's super thin, she has those sort of bug eyes glaring out, and she has a goiter, enlarged thyroid on her neck. This is someone who has low thyroidism. So a little bit puffy, that's called myxedema. If you deal with if a child is dealing with hypothyroidism, it can affect how their brain develops and how they think, okay? And you can see it's about 1% of the American population, which is a lot of people. It is more common among women. It's not responding, fine, be that way. It is more common among women because a lot of, I'm going to say, abnormal thyroid function is associated with what's called Hashimoto's. I don't know if y'all have heard of Hashimoto's, but it's an autoimmune condition of the thyroid. Autoimmune basically means your body is attacking yourself. You can have rheumatoid arthritis, you're attacking your own joints. You basically can attack any organs. Your body can decide, okay, I'm going to attack it today. Why does your body attack itself? There's a fair number of theories out there. I think there is something to this. Our gut doesn't work right, and so it's not doing a good job of filtering what we're eating. And so our body then thinks that these sort of unfiltered nutrients are bad, and they confuse that with our thyroid. So for example, if someone has autoimmune thyroid issues, there's probably some value in going gluten-free, at least for a season, to see if that helps calm things down. Women, I don't know why we're, visited with autoimmune diseases more, but statistically, women just have a lot more autoimmune diseases. We just attack each other. Oh, I'm sorry, ourselves. Okay. This is just giving you some examples of hyper, okay, meaning overactive thyroid. And then this is Barbara Bush, who recently passed away, but she had hyperthyroidism. And what's interesting is both, isn't that true? I think both she did, her husband did, and I think the dog all did, had hyperthyroidism. Now,
all right. So everyone, I'm Chris May, Seaside Pharmaceutical. Everyone pretty much knows me here. I appreciate the opportunity to share maybe what we can't share at the lobby at the lab. So my approach to thyroid is completely different because number one, I have family very dear to me. My wife is a very brittle, what I call a brittle thyroid patient. The slightest adjustment in environment, diet, exercise program, anything causes her thyroid to completely change. And we dealt with that for years, to the point where we had been married approximately, 1990. We were married 11 years and had tried to have children, and everything was functioning and everything was fine, but we just could not conceive. And so I'll give a shout out to Dr. Darren Strickland. He looked at Christy one day and he said, "You have a thyroid issue. And so we're going to put you on some levothyroxine, and we're going to test and see if you're pregnant in 4 weeks." In 3 weeks, she had conceived, and I have a 17-year-old now. So even though I was a pharmacist, had been trained in chemistry and all of this kind of stuff, I'd been a pharmacist for 11 years at that point. And no one had ever even remotely told me, hey, they might have thyroid issues if they can't get pregnant. Now, how does that even enter into this conversation? And it's basically this: the thyroid is the thermostat. So in the environment that we're here, it's nice and comfortable, and it's, I guess, homeostasis is what we're trying to achieve. If we crank it down to 60 degrees and let the air in from outside, it's going to change our parameters, and it's going to change the way we act and respond. And that's the biggest takeaway that we all need to remember in thyroid, is that we can't set it and then just let it go. It's not one of these thermostats that is the new technology where you can set it from your phone. It's a constant dynamic change. It's a change in environment, a change in diet, again, a change in exercise program. There's so many different factors. Then on top of that, we have this one thing that we all don't really like to talk about, and it's called time. And every day that we are a little bit older, our thyroid's going to be different. It's a day older. It's a machine. The good Lord designed us to be so efficient in a range. And so hyperthyroid, outside of the range. Hypothyroid, outside of the range. In the middle, we're all great. So with that being said, I wanted to kind of share a little bit about why does normal docs, not like Dr. Bowen, say, let's just put them on Synthroid. Let's just do T4. T4 is the way to go. And Dr. Bowen mentioned on that. And the reason is because they can control it. It's a little bit easier to understand as we look at the different charts of what can work and what can go wrong. T4 is kind of to allude to the horse and buggy situation. T4 is stored T3. The body, when it sees T3, it just uses it, and then boom, it's consumed. But T4, the body, the lock and key mechanism that the body has cannot activate the T3 in the T4 without certain things happening. On top of that, the amount of storage of T4 is usually a long period of time. So what we're doing today is going to affect our body 6 months from now, because that's kind of the rule of thumb to use in a T4 storage situation. Because again, the mind controls our thoughts and processes and controls what we're wanting to eat. But then there's something that's backing all that information up and saying, oh, we ate this on this day and it got us this amount of nutrient. So we're going to ask for this time whenever this nutrient gets low. And technology is just now tapping into the old adage of Mom said to please eat your vegetables, we're just kind of rediscovering that medicine is food and food is medicine. And for instance, on the way over here, I said, okay, I'm not going to stand up in front of everyone and have my stomach growl, so I'm going to grab some little sugar snacks. Okay, that's great, but I'm going to suffer for that later because it's not what my body needed. Sure, it gave me a little bit of sugar, it gave me a little bit of a boost, but it wasn't good food. And not knocking Synthroid, not knocking levothyroxine, because I have a son because of levothyroxine. But what I am saying is that if out of all the different choices that we have out there, if we can as closely mimic the body and the way that we are designed to be, then why don't we consume that same thing? So levothyroxine is a part of it, but it's not the total package. So you have the T4, and on the little second page of the little thing I stapled together, I'm going to share a little bit of history that I know, and I'm sure that this can be checked and it may be completely different, but this is the way it was explained to me. So originally, after World War II, when they had done all the developmental stuff on what should nutrition be, they had all of this data because they had all these GIs that they had to feed for 5 or 6 years. And then as they exited out of the military, what was their physical states and all this kind of stuff. They also had some testing that had been done over in Germany and during that time in times of war. So they took and they knew at that point in time that our bodies needed more thyroid. They also had known 50 years earlier that our bodies needed iodine, or else Theodore Roosevelt would not have been asked to put iodine in the salt because we had such a goiter issue at the turn of the 20th century. And it immediately reduced that because, number one, it was an iodine issue. And iodine, is we'll get into, is just, it is the T4, it is an iodine molecule that is given off and created and converted, and therefore you get the T3. So the body uses that iodine to store the little energy bursts, much like the little sugar snacks that I had on my way over here, to give the body, say, hey, there's some T3 here, we just need to get it converted. So scientists knew, physicians knew that it was an iodine-related issue. They also thought that it was not as segmented as this diagram shows. They thought, well, we have thyroid, and the thyroid causes all of this to function. But all of us know that as technology advances, we get more direct and more specific and layers upon layers upon layers. And it was discovered that, sure enough, there are two parts to thyroid, which is T4 and T3. So the next step is well, what is the ratio? And Dr. Bowen had mentioned this earlier. The ratio is about 80% T4 to 20% T3. So pharmacists, being the astute gentlemen and ladies that they are, or just sheer dumb luck, they had already been taking pig thyroid, desiccating it, drying it out, grinding it up, and creating tablets out of that. And they had been doing that for 100 years, before the 50s, before the 60s, before the 70s. And that's why when you go to the store or you go to a physician and the physician writes the prescription and says, okay, we're going to put you on 1 grain thyroid, and that's 60 milligrams of thyroid. Well, in reality, if you will look, 60 milligrams of thyroid is really 38 micrograms of T4 and 9 micrograms of T3. So as hard it is to really understand thyroid function, medical science has made it even harder because we call it something completely different than what it really is. So if you're looking at this and saying, okay, I've got thyroid issues, and all of us do, then what is the next step? What do I need to talk to my doctor about? What do I need to start researching on the internet about? What do I need to let Dr. Google be my guide and tell me what to do? And the simple thing is to start out, if you're already taking a T4, well, let's find what dose you're on. Come down this list. Say, well, I'm on 100 micrograms of T4. Well, if you were on that and you had a working T3, the doctor would have you on a dosage of 180 milligrams. That's a lot. That is a ton of thyroid. So again, we have to go back and look at the ratio of it being a blend. When we do that, then we come to the assumption that in true reality, a 60 milligram is equal to 100 micrograms of T4. And that's one thing I wanted everyone to take away. That's just the rule of thumb to always use. Whether y'all are talking to someone in the state of Oregon, New York, Georgia, China, wherever you're at, if they say, oh, I'm taking Synthroid 100 micrograms, just know in reality, the body sees that as a 60 milligram or a 1 grain thyroid, okay? And that's going to come into play when we go back to the first page. The first page just kind of is a brief rundown of these few little vitamins that are in our foods that we need every day because we have thyroid trouble. So instead of me just reading them off to you, the one thing that I wanted to really kind of pinpoint was the chemical selenium. So selenium was one of these vitamins that, you know, if it got mentioned, it's in the minerals and it's just there, and yeah, people need it. And that was our whole extent in school about selenium. But if you will stop and look at thyroid function, the thyroid gland contains the highest concentration of selenium in our whole entire body. And again, its purpose is for antioxidant properties. But it is the creator of the thyroid hormones. So it is where the body actually begins the packaging of the T4 and the T3 to get it to go down to the liver for activation. So without the proper amounts of selenium, we can't even get the game started. It's kind of like the football without the teams. Or else you have the teams without the football. The next thing that comes into play again is iodine. And with the iodine, it's a matter of balance. If we have too much iodine, what's going to happen? It's going to actually drive our T3 up. And what we have learned tonight, T3 is fast. So all of a sudden we get too much iodine, T3 goes up, all of a sudden we go into a hyperthyroid state. And I can kind of say, because, Chris, the pharmacist, is going to help his wife feel better. And now that she's pregnant, she's going to be great and everything's going to be good. And all of a sudden I drive her iodine up too much and she feels miserable because she's tired all the time. Because I didn't have the selenium to kind of support that. We didn't have the B vitamins to support that. We didn't have the folate to support that until she started the prenatal vitamins. So again, it's a hand in hand of the foods we eat and the medicine that we take. because food is medicine and medicine is food. So the takeaway from my little time here is the middle of the road is the best way. We can't go too high, we can't go too low. We have to establish what too high and too low is for every single individual. And that's what makes thyroid function tough. But it's easily conquered as long as we keep the same parameters and we use those parameters to build off of and share with each other and say, hey, you know, this has got a ton of selenium in it and it really did great for me, and my hair thickened up, and you know, my eyebrows grew back and my skin looks wonderful. And that's the biggest thing I can say, is that thyroid function through the years has been all about finding a better way to still do what our body was designed to do originally. And through these vitamins that are listed here and a blended thyroid function hormone of some type, we can get that achieved.
Our slides are sort of concluding slides. So some of the things that I want to echo is, you know, talking about what works for June doesn't necessarily work for Jane. Mm-hmm. And so I think that's where some of this nutrient testing that we can do, there's several companies that do that. And then y'all have, or are going to talk with Lauren, but she can talk to you about that. Is, you know, sometimes what happens is, oh, on Dr. Oz, they were taking B12, and that was like really good. And that biotin, oh, biotin is great. Mm-hmm. Well, it isn't that we're against any of those things. I think obviously Chris and I are a believer in supplementing what we can't extract from our foods. So I think in general, it's a well-balanced diet, not to lose weight, but a well-balanced diet first. And then I think nutrient testing for individuals to say, okay, where are there some gaps in how well you're absorbing? And some people genetically are just not that good at absorbing Bs.
That's right.
There are areas of the country, and I think this is one that the soil is naturally low in selenium.
Yep.
So you may need to supplement if you live here versus you're in Michigan or Canada, you don't really need to do that much.
And high in calcium. And so calcium is a retardant to thyroid absorption. Direct retardant.
Right. And then that goes to like, when should you take your thyroid medicine? So while I'm clicking through, you can chat about that.
So, okay, so here's the other thing that I kind of laugh about now, but the very first thing that a physician will do is they'll put a person on Synthroid, or they'll put them on a levothyroxine of some kind. And they go to the pharmacy, and the pharmacist was real busy, and they said, yeah, you just take this once a day. If you have any questions, give me a call. Okay, great. So you have this pill, this one little pill. And so when are you going to take it? You're going to take it with your coffee, after your breakfast, or, oh, I forgot, I'm going to take it at supper. Absolute worst thing to do, because, again, this is a hormone. And hormones don't like acid. And our stomach is full of acid. So if we take this hormone with food, the acid is already secreted, it hits, it doesn't break down, and we absorb about 10% of it. On top of that, not to bore you with chemistry, it is a positively charged ion. Thyroid is. So it's, in other words, when it sees that acid and the acid is positively charged, they don't mix. And so it doesn't absorb. So proper taking of any thyroid, whether it's a blend, whether it's just levothyroxine, whether it's just liothyronine by itself, is with a sip of water first thing in the morning when your body wakes you up to go do what it has to do. That is it. I mean, it should be by your bed. So, yes.
And I think just getting in a habit. So I think that's, you know, a lot of times people feel like whatever the supplement is, and thyroid is a supplement. I mean,
Yes.
medicines are a supplement if you want to look at it this way.
That's right.
They think, well, it's just not working for me. I've been doing it for 2 weeks now and it's not working. Okay. Well, number one, you could have been doing it faithfully, but you could have been doing it faithfully wrong. Okay, so that's those types of issues. And number two, 2 weeks, and for some things 6 weeks, and for some things 3 months is not long enough. Okay.
Right.
Although on thyroid meds, you probably, if you're still on dealing with things after, I would say 6 to 8 weeks, you probably need to. Okay, so I'm just going to cover this real quick, but I mean, this just talks about how is it diagnosed. Obviously, on taking a family and personal history, a physical exam is key, and the lab test. And then this is talking about early detection on women over 40, since it's more common. We haven't really talked about hyperthyroid because that's really a whole separate chat. And that is it's the same organ going in a totally different direction, so different treatment modalities. But I think that this one certainly makes the point that you're going to do individual dosing, and then you also have to understand that what worked for you in one season of your life may not work for you in another season of life. And that can be frustrating too, because you've been taking the same dose for so many years, and all of a sudden it's like, it's not working, what's going on? And because it's worked for you for so long, you're thinking, you don't even think about thyroid. You're thinking, okay, it's something else. Well, then, you go get your lab test done, and then, ding, okay, your thyroid isn't, you need more, you need less. I think, what is responsibilities of all of us, because all of us eventually become patients, is you want to share with your physician your symptoms. I think that it's important to look at not just the TSH, but the free versions, the T4, the T3. And then this talks about taking your thyroid medicine separately from, milk. Nothing like your thyroid pill with a big bowl of yogurt, really healthy for you. Okay, and then don't mess around with your dosage. And then I think listen to your body. I mean, if you were cold sensitive, it got better, and then you start getting cold sensitive again, that would be worthwhile bringing it to your provider's attention. And then if you feel, I think that's where you got to listen to our bodies. If you feel like something's not quite right, I think it's perfectly fine to say, hey, do you mind checking my thyroid? I feel like something's not quite right. And then these are just some little tips on how to help your doctor help you better as a physician and as a patient. Sometimes what happens is, we're so, well, of course nowadays, busy typing in on your computer, you have to listen to the person, they're coming in, your brain is over here. I think that's one of the things that we both have to slow down, and you're bringing to the table some symptoms, and you may have looked it up on the internet. And you refer to Dr. Google, and then you say, well, on the internet they said X, Y, and Z. Okay, well, that's just a surefire way to get your doctor to turn their off button on, because they're like, they don't even listen to me. Okay, so just I think it's okay to share. I've done some research, but I'm coming to you. The reason why I am here is because I value your opinion. If I didn't value your opinion, I would have just stayed at my house with Dr. Google, right?
Yes.
And then it's just sort of a summary, and then there we are. That's actually the end.
Yes.
I'm trying to think if there's anything else. So I think from the general perspective, y'all feel like you have a pretty decent understanding of low versus high? Feel comfortable with that, or somebody stepping away? And then I think the point that Chris was making is understanding that we change with time, and it isn't just a purely time thing. I think it has to do with life circumstances. So again, being treated for hypothyroidism, it isn't, even that automatic thermostat, there's a little gear back in there that is constantly monitoring the temperature to adjust it so it feels sort of even for you. And I think it gets back to do some nutrient testing and understand that it's sort of like driving. We don't have automatic cars yet, and so when you're driving, even though you're staying in your lane, if you look at your hands, you're making little motions back and forth to sort of keep that steady state. And so I think that's where eating a well-balanced diet, being sensitive, you know, sometimes things that can mess with your thyroid, I'm going to say, I always this word toxin. But, you know, can be things that are new to your diet. Okay, so, you know, one of those things that I know was popular, well, it still is popular, they sold women, menopausal women, on soy products.
Right.
And let's take lots of soy milk, soy this, soy that, soy this, soy that. Well, guess what soy does to your thyroid?
Yeah.
That slows it down, baby. And so if you have a low thyroid, I'm going to say, I don't like soy. And frankly, I don't like soy-based baby formulas. Why would you want to give your baby a product that slows your baby's thyroid down? That's the last thing you want your baby to have. But that's I can get on for soy another day.
Well, and again, the next biggest thing is with an exercise program, because the first thing we're going to do, if our thyroid starts creeping lower, we're going to put on a little bit of weight, and it's going to be in fluid. And so our culture has said that means you're not exercising. So the first thing you're going to do is like, oh, I got to eat healthy. So what I'm going to do, I'm going to grab a protein bar. Well, what's a protein bar made with? It's made with soy.
Yes.
I mean, it's just what it is, or a whey protein, but it is a soy base, so it's going to further exacerbate the symptoms, and you're not going to move.
And then you're putting stress on your body. And then you get stressed out, and then your thyroid says, okay, forget it.
Yes, and so then your hair falls out, and then you look like me.
Okay, well, we appreciate y'all coming tonight.
Thank you, everyone.